Thank you so much for inviting me to spend this time with you all today. I'm really thrilled. This is certainly a subject matter that I'm passionate about and have spent much of my professional career working around and trying to learn more and do more to support our students with disabilities. As Dr. Prabhakaran has said, using terms like differently abled, being able to use inclusive language with our students with disabilities is one step in the right direction. But I'd like to share a little bit with you about kind of my practice in the realm of public education and how we kind of identify and address the needs of students with disabilities, at least here in the United States. So I will screen share and offer you my presentation here. Hopefully everyone can see here. So this is the topic of my presentation today, and it's really an extension of kind of where Dr. Prabhakaran left off. Oftentimes we have students that are identified very early on in development, and other times when they're only identified once they come to be school age. So we'll talk a little bit about that. But to provide a little context for the work of school psychology here in the United States, we had a cultural shift in the 70s here during the civil rights movement. And it was during that time that people that are differently abled were recognized as a population in our country that wasn't getting served equally. And so it was at that time that education was really determined to be a civil right. And it was determined that all public education had to be inclusive of these students with disabilities and find a way to provide them with equal access to a free and appropriate education. And that kind of gave rise to the role of school psychology, where we recognize we have to have people that have the ability to understand different disabilities and what special education supports and services will allow students with different disabilities to be able to be successful and progress to the best of their ability in their education. So that is the role of the school psychologist. So I'm a practicing school psychologist by trade. I got my doctorate in school psychology, and now I work in administration, where I'm part of making decisions and developing programming and services to utilize our special education supports to meet the needs of students. So that's our field of special education. We have special ed teachers who develop an expertise in the instruction of students with different disabilities. And we also employ a variety of related service providers like speech and language pathologists, occupational therapists, physical therapists, social workers who can provide those additional supports to students in the school system. So that's kind of our realm of work. In the United States, students with disabilities can begin receiving special education services really from the time they're born through the age of 21 and beyond outside of the school system. As Dr. Prabhakaran was saying, sometimes we can identify students' disabilities prenatally even. We can look at chromosomal abnormalities or structural abnormalities that are likely to lead to difficulties in terms of learning and development. And so we can allow them to get access to services and supports right from the very beginning. I, in public school, work more with students that are preschool age, and they have evaluations, and we make some determinations about whether they qualify for services outside of school during that preschool period. And then certainly during school age, the special education programming in all public schools has become quite extensive. In order to qualify for special ed services at school age, you have to qualify under one of these 13 different disability categories. And so the part of the role of the school psychologist is to conduct evaluations on students to determine whether they meet one of these criteria. And if they do, put into place recommendations around the appropriate services to meet that student's needs based on their disability. Here I've highlighted for you some of what I would consider the most high incidence disabilities that we see in schools and service children around. Autism is certainly one that I think most people have started to hear quite a bit about now. Learning disabilities, reading disabilities, math disabilities, we'll talk about a little bit more in detail later. Students with mental health, emotional, or behavioral needs might qualify under that emotional disturbance. Other health impairment is a kind of catch-all term that can look at students. Oftentimes I see students with, let's say, attention deficit hyperactivity disorder that would qualify under that category. And certainly in the younger years, speech and language development issues are pretty common areas of disability that we see in service. But we usually have kind of a smattering of all of them in any given school district. To give a little snippet on what does that process look like around initial evaluation, it's quite extensive. So here, any parent can request an evaluation from their Committee on Special Education. It's based on the county that you live in or the school district where you reside. And when that evaluation takes place, a school psychologist would engage in a number of standardized testing measures to look at students' development in different areas. So we certainly take standardized assessments of cognitive functioning. Those are like IQ tests, where we look at different areas of cognitive development and determine whether or not that student is functioning within the average range compared to typically developing peers, or whether they would fall outside of that range in certain or all areas. So the standardized measures that we use have to be administered in a very specific fashion so that you can really compare apples to apples, right? So when I assess one student, I have to use the same technique that I would use when I'm testing another student to make sure there's not variability in performance that's based on how I delivered the assessment. So those standardized tests are given to kids across the United States of America. Those scores are then statistically analyzed in the normal curve there, right? Statistically to determine what's kind of within the average range and what's outside of that range. So we do that in cognitive areas. We look at academic development, where we would expect students to be functioning in their reading, math, or writing skills. And similarly, in terms of social emotional functioning, we look at behavior rating scales, measures of how students are able to function in terms of emotional coping, in terms of their presentation socially. And those are rating scales we would administer to parents, to teachers, sometimes to students themselves when they're a little bit older and able to respond. Psychologists will also go in and do observation of the student across multiple settings in the school in order to really get a picture for how they're functioning in that setting. And you can learn a lot from those things, as well as clinical interviewing parents, interviewing teachers, again, interviewing students themselves as they get older in terms of their own understanding and awareness of their areas of need. We review their records, look at their previous performance, look at things like attendance to school, look at things like behavioral disturbances or behavioral issues that may have been occurring in a pattern. And we always attempt to collaborate with outside providers. And that's kind of mediated by parental will there, right? So we have to have permission from a parent. We have to have them tell us it's okay to reach out to pediatricians. But when that is possible, we certainly see that we get the best results. And in some of the case examples I'll share later, I'll talk a little bit about how that communication has helped us to be able to meet student needs better. An initial evaluation could also include some other supplemental evals, say by speech and language pathologist or an occupational therapist in some of those other areas in order to gain information on functioning in those kind of areas of specialization that will help us come to a determination about whether a child qualifies for special education services. So once we've made that classification decision, we've said, okay, this student meets the criteria for this disability category. We have to then decide, what are we going to do about it? How are we going to help that student to access their education and not have that disability become a barrier to their performance and their functioning in school? There's a couple of big ideas in special ed that I thought kind of give you a picture of how we make those decisions and how we think about education and special ed. The first is that we look at using those services to level the playing field. In other words, we're not looking to give any kid a leg up on someone else. We're not looking to maximize someone's potential necessarily. Although certainly we would like that for every child. That's certainly not in the cards in terms of the funding piece. And we're not able to do that for everybody. But we want to make sure that we've understood what is the area of deficiency that we can mitigate so that those students have access to their full instructional program. Also, we operate with the assumption that students do better developmentally when they are in the most typical learning environments possible. And that's what we refer to as the least restrictive environment. So in the past, there was this idea that we would segregate students with disabilities. We would put them in a special school somewhere else, or they would be kind of left out of the educational milieu because their needs were different. And that has an impact not only academically, but also socially on children. And so part of our requirements actually through the regulations are that we look for ways to provide support and special ed services to students in the most typical learning environments possible, which means we would push those services sometimes into a regular classroom. Sometimes we have students in a special classroom, but in a regular school. Sometimes, however, we do have to have more specialized programming in a classroom or a school that's outside of the public school. So that's what we call our continuum of special ed services. And we have to really identify what students need and how much we can deliver in a regular classroom setting. So that's a big kind of focus of our attention. And then the third factor is that here, parents have a lot of rights, and their voice has to be heard in the educational decision making. If they disagree with the decision that the school district is making, they have the opportunity to fight back, to rebut that, to offer their own interpretation of their child's needs. And we have to really work collaboratively with parents as part of our responsibility. Also, students have rights. And there are a lot of protections in place for students with disabilities to make sure that they are not unfairly treated. For example, that they're not disciplined for a behavior that's really related to their disability. So that those are some of the kind of basis of a lot of our decision making. I like this visual because I think it offers a really good representation of how we view special education services in schools. As you can see in that top row, everybody gets the same bike, right? It's the same size wheels, it's the exact same bike. And we say, well, that's equal, right? Everybody's getting the same thing, so everybody's being treated fairly. In the special ed world, we would say, not really though, right? We're looking more at providing equity. So we know that somebody with shorter legs is going to need smaller wheels. Somebody with bigger legs is going to need bigger wheels. Somebody that's in a wheelchair might need to have a bike that they can use their hands to pedal. So really, it's a good illustration. We certainly have students with a variety of physical disabilities where this is an actual representation of kind of how we would deliver a special ed service, providing them with adaptive equipment. But it also relates to how we support those students in different ways in terms of the instruction they receive and the materials that we use to provide them with special ed services. So when we think about special education as a whole, there are some kind of classic features about what makes that special, right? So when we're designing instruction, we think about how is it going to be delivered to students? What methodologies are we using in terms of the pedagogy, the way the teacher is instructing? What materials are we using with students based on their needs? We have a whole variety of things that we might do differently based on how a student learns. Things that are as extreme as using Braille for someone who's blind, right? To using maybe some more physical manipulative tools and activities for a child that might have a difficult time focusing and paying attention. We also give students multiple ways of demonstrating their knowledge and being able to participate in instruction. And then it may also alter the actual content that we're teaching and what we're focusing on instructionally for students. So those are all some of the things we look at. I thought it might be helpful to kind of hone in on a couple specific examples of our more high incidence disabilities to kind of illustrate some of those principles of special education. So I'll talk a little bit more in depth about learning disabilities. Those are things that people often know at least a little bit about. So learning disabilities, core features are that you're typically dealing with a student who has really average cognitive skills. They're intellectually average functioning, sometimes even above average functioning, but they have maybe one area of cognitive development and one area of academic deficit that kind of are unexplained by their general cognitive abilities. You know, you expect them, they're smart, they're bright, but they still just can't seem to crack the code in reading, right? Once we kind of see that linkage, we have to look a little deeper to rule out other factors. And that's part of when we do that in-depth initial evaluation. We look at things like, when was their last audiology exam? Did they have a hearing screening and a vision screening? Are they actually able to read the letters on the paper? Have they heard the sounds correctly? Or let's say, is it a student that's had chronic ear infections who hasn't really had the same auditory input? And that's part of playing into why they're struggling with reading. So we have to look at some of those other factors to rule out other causes for those delays in that particular academic area. Another thing that we really look at is, did they have access to adequate instruction, right? And those are things that will help us to determine, is this truly a reading disability? Certainly we have students that will demonstrate different symptoms of a disability that may not actually have a cognitive brain disability. It might be a matter of exposure. So I've linked in here in the presentation some resources that help explain in more depth and detail what dyslexia is. Dysgraphia is a writing disability. And I don't have time to go into great depth here, but some of the features that we want to explore, I will talk about in reference to a student. Give you an example of Shane, a third grader. So we see a student who he went to preschool, so he had some exposure to letters and sounds in preschool. He went to kindergarten, he went to first grade, he went to second grade, and sequentially each year, despite having adequate instruction where teachers were working with him to try to build that connection between, here are the letters, here's what they're called, here's the sound they make. When you put them together, they blend together to make another sound. He really hasn't been able to crack that code. We look at reading in 5 different areas, and delays or kind of abnormalities in students' ability to kind of hold on to knowledge or learning in those areas can be characteristic of dyslexia. So when we see a student that's struggling in that way, oftentimes they can also demonstrate, like Shane, some behavioral issues in the classroom. And I think Dr. Prabhakaran actually talked about it a little bit, the curriculum stress. So imagine you're putting in maximum effort to try to learn. Why does everyone else seem to get it? They're reading higher level books and I am still struggling to be able to match these 3 letters together to make a word. So students that have true dyslexia, it's often extremely frustrating. Certainly things that make it worse are if teachers or parents think their lack of progress is due to laziness, or because they're not studying hard enough. Or because, worse yet, they're just not smart overall, right? They're just dumb. That might be how students start to see themselves as well. So that's one of the reasons it's really important, we say, to catch it early, to talk about what's appropriate developmental progression. And when we don't see that progress happening, we need to get in there and take a look at what's getting in the way. So for Shane, we realized we were seeing some behavioral difficulties. He was kind of distracted and starting to get a little bit naughty when it came time to do independent work at the desk because he didn't know how to do it. So he went through an evaluation. We determined, yes, he truly has a learning disability. He has dyslexia and also dysgraphia. So not only does he have trouble interpreting those words on the paper, but he can't produce them either, which is not surprising. We often see that comorbid. So he can't sequence the letters together appropriately when he's writing. He struggles sometimes even to remember the right way that the letter is supposed to go. So he might invert the letters. We might see reversals, things like that. So things that we would do to support a student like Shane in the classroom. Well, first, we're going to offer him some specialized instruction from a special ed teacher to continue to work on developing his phonetic understanding. And that might occur both in the classroom and in a small pullout group where we do more repetition, modeling, and practice of some of those early reading strategies. Other things that we want to be thinking about are, now that he's moving into 3rd grade, all this time in early education, we focus on learning to read, right? And then as kids get older, they start having to read to learn. So when you're in social studies class or science class, and you're given a textbook that you're supposed to start reading in order to learn the content, Shane's not going to keep up with that. So now he's going to look like he's not very smart in reading, but he's also going to have trouble progressing in science and social studies if we don't make some accommodations to ensure that we mediate the impact of that disability in those other areas. So things that we might use are giving him some formatting differences in terms of the material we offer him. So sometimes less words on a page or shorter passages are helpful. Sometimes we want to use technology like audio versions of a textbook so that he can listen to it and absorb it rather than having to laboriously read his way through a textbook. We also offer speech to text. So all computers now have it, right? Google's amazing. So we have kids on little headphones with a microphone. They can speak into the computer and the computer can write for them what they're saying, because Shane's got great ideas. He's really smart. He knows what that story was about, and he can make a prediction about what the character is going to do next, which is what he's supposed to write an essay about, but he's never going to write a full page essay like his peers because he's going to get hung up on 3 words in the first sentence, right? So those are the kinds of things that we think about doing to accommodate. We also give some strategies for comprehension. And we're always thinking about in special ed, how are we giving kids tools and strategies that they can use independently as they get older? What the research shows us is that a lot of children with dyslexia and dyscalculia, those disabilities, they can make progress. They can learn to read. It takes longer, and they may never be as fast or as quick at doing it as their peers. But if they have other tools and strategies in their toolbox as they progress academically, they can be very successful. But that's part of the special ed piece, right? Is we're helping identify it, we're helping teach them those strategies, and then they can employ them as they move on in the classroom. We also make sure they have other accommodations like extended time for tests or having the directions to test read to them so that they're definitely answering the right questions, right? And they know what they're doing in that sense. In terms of handwriting, we look at both kids that have difficulty in terms of dysgraphia, both kids that have difficulty with their spelling and sequencing letters. But we also know some kids have an immature grasp. If they're still trying to write words when they're fisting their pencil, or they have a grasp that is not efficient when they're trying to write, that's also going to slow them down. So that might be another area that we're looking at in terms of providing occupational therapy, showing them, correcting their grasp, giving them opportunities to get some explicit instruction in letter formation. Those are also some services that we might put in place for a student like Shane. He had both. He needed some support structurally for his hand in order to learn how to form letters correctly. And that's something the occupational therapist can work on. So we might give Shane also a word bank and some things that he can utilize as a pre-teaching vocabulary and things like that when he's reading or learning about text. So those are just a few examples of something we might do for a student with dyslexia. Math learning disabilities are referred to as dyscalculia. Similarly, these are students that are average intelligence, but there's something that's just missing in terms of their ability to interpret number sense, we call it. So quantifying things, understanding connections in terms of patterns, being able to retain in that short-term working memory, holding on to the number 5 and 3 when you're trying to subtract 3 minus 5. You have to hold on to those numbers in your head for a second while you're completing that calculation in order to be effective in problem solving. And when you don't have that ability to hold on to that information, that's part of where you can see a breakdown. So those are some of the things that we look for with dyscalculia. Again, this is despite having appropriate opportunities to receive instruction. You just aren't cracking the code in terms of the numbers and the calculations. Sometimes we have students that have the ability to do a rote calculation, but they don't really understand what it means. So you could do that division problem or the algebra problem, but let's say we give you a word problem and ask you how to solve that problem or interpret your results. They're not able to do that. So that would be some examples of a math learning disability. We would do some of the same things as thinking about what tools do we need to give you in order for you to better interpret numbers. So we use things like manipulatives, physical representations of numbers for students. Certainly with computers now, you have a lot more graphically that you can do in terms of giving kids the opportunity to see things on on a computer. We give kids number lines to kind of understand positive and negative integers, and keeping that in front of them the whole time, having reference sheets for problem solving, the steps. Instructionally, things that benefit students with dyscalculia would be doing a lot of modeling where you're thinking aloud. So when the teacher is teaching how to complete a math problem, they're making explicit their thought process in terms of what the next step is and why. Those are good strategies for helping kids to build that sense of numbers themselves. Kind of a big conversation that often comes up with students with math learning disabilities is when to introduce the calculator. And I know that's a really big thing. We want all kids to build fluency with their math facts, because that allows you to do higher level math more quickly and efficiently. But what we know is, if this is an area of disability for a student, they may be able to progress with their same age peers if they're not hung up on the what's 3 times 5. So if we give them a calculator and that allows them to do higher level math, to do algebra and trigonometry and all of those things more efficiently and quickly, we want to introduce that tool earlier on. It doesn't mean that we necessarily throw in the towel at working at that math fluency, but it gives us the opportunity to give kids access to higher level math, which they can do sometimes without that getting in the way. So that's another thing that we have a lot of conversations around, and when we're making determinations about when to employ what strategies for students. Very quickly, and I know time, I don't have a ton of time with you today, but I wanted to give a little peek at students with autism may also have comorbid disabilities. I have a little guy in school now. He has autism spectrum disorder and ADHD. So I thought I'd talk a little bit about both of those disabilities and how they present in school. The saying goes, if you've met one person with autism, you've met one person with autism, right? Sometimes people like a nice picture like, oh, you know autism because this, and this, and autism, students with autism are all the same. And that's truly not the case. Autism can occur anywhere on a spectrum. I have children who are nonverbal, who are extremely severe cases of autism where they have a lot of needs that have to be met in specialized settings. And I have a child actually with autism on my caseload now I'm ready to discharge him from special ed services. Not that he doesn't have autism anymore, but it's mild, and he has the tools and the abilities to be successful as a differently able person with autism. So there's a whole range in there in terms of how students present, but typical challenges that you see for students with autism in the school setting has to do with sensory issues, being highly sensitive to sounds, noises, sometimes textures and tastes. Difficulties with fine motor delays are very common in students with autism. So some of those examples I was giving you about having difficulty with motor coordination, either with pencil grip or with the ability to kind of form letters because they may have poor muscle and stamina in their hands to do long handwriting assignments. Certainly social and behavioral needs are a primary feature of autism spectrum disordered children. Difficulties with adaptive behaviors, that's like self-care, being able to follow routines and kind of the regular classroom or school rules and functions. Difficulties with communication and some splinter skills academically. Oftentimes children with autism may have very highly developed skills in one area. The little guy that I have in school right now, he has awesome math skills. He's really able to do grade level and even a little above grade level math. He can read. However, the functional application of those skills and in terms of being able to know what it means, what he's reading, is lacking. So those are some of the things that we're talking about with splinter skills. So this little boy also has ADHD. ADHD is a developmental disorder. It is, again, primary features. There are kind of there's 3 types. There's primarily hyperactive and impulsive type of hyperactivity, attention deficit disorder. There's primarily inattentive type where it's just distractibility, difficulty sustaining focus, a lot of executive functioning difficulties, so planning and following through on a task. In this case, my little guy, Roy, has a combination of really hyperactive, impulsive behaviors where he has so much energy in his body, he really struggles to sit still. Part of that is also related to autism in terms of his sensory seeking needs. So he's a student that we need to give him a lot of sensory input, short bursts of academic work paired with some sensory breaks where he's able to use manipulatives and things in his hands to get some sensory input. Oftentimes he'll need to go for a walk. He'll need to do some wall presses where he's getting some input from his larger muscle groups. I already said he's got those splinter skills academically. He has a lot of social needs. So we have a social skills group where he needs people to explicitly teach him some of the norms of behavior, having a reciprocal conversation, being able to look someone in the eye when they're talking. That's another feature of autism. It's difficult for him. But being able to respond when someone calls your name and look at them and respond appropriately. So that's a lot of the work that we do with him. I've had a lot of collaboration with his mom and his doctor. When he first came into school, his hyperactivity was off the charts. He would come in, he has a perseveration over school buses. So he hyper focuses on school buses, and he would want to get out to the school bus. He wants to just watch the school buses, and he would run. And so we had to put some things in place in terms of bringing that impulsivity down a little bit so that he could be available to learn in the classroom, and respond to some of the behavioral programming in the classroom. But I really needed to work with mom and the pediatrician on that because he was taking a time release dose of ADHD meds that were wearing off too early in the day. So I communicated with the pediatrician. We asked, let's try doing a morning dose and an afternoon dose of medication instead of the time release all day. And this is a kid they thought wasn't going to be able to stay in a regular school. And because we were able to make that medication shift, he was able to manage his behavior and stay in school for the full day. So that's an example of some of the kind of collaborative work that we do with outside providers. And we keep monitoring his progress in those different areas to see what things do we need to tweak or change to allow him to continue to be successful. So at a kind of a minimum, I have so much advice for parents and practitioners, but I think if you nailed it down to a few pointers that mean the most, certainly, as Dr. Prabhakaran said, early in development, having a home and an environment where kids are able to engage in developmentally appropriate play with peers, to be able to have access to appropriate learning opportunities. Reading with children every day builds vocabulary. It builds that love of books and learning. It builds letter and sound identification skills if parents are willing to spend the time to do that with kids. Those are all really important things that help kids develop early on. Early identification when kids aren't meeting their developmental milestones. I did link in here, if you open it up, we don't have time right now, but there are things that we expect kids to be able to do at different ages. And there are certain markers that say, you know, if they're not communicating at this age, or if they're not able to crawl or walk independently, or they're not able to engage in some typical life skills, being able to understand some of the basics of your daily life activities. Those are markers that we may want to look a little closer, and that communication with pediatricians, with teachers who know what's typical for the classroom age of those students can be very helpful. But some of the things for parents to keep in mind is being able to accept that the path that you had in mind for your child may not be what's in the cards for them, right? Your expectation that they were going to be top of their class, that they were going to be the highest performing, may not necessarily be an appropriate expectation for your child. Those are sometimes tough pills to swallow, to really understand and accept differences as being okay, that your path may be different than what I initially anticipated is a really big piece of being able to support your child as they move through development. Working towards inclusion and supporting students and children in ways that are meaningful to them, to allow them to participate, even if they're not the best at something. Those are really important. Doing things like praising effort over achievement. So some kids are not necessarily going to match up to where the class average is, but you know what, if they started here and they made this progress, that's something to be proud of and to praise. If they put in that effort to master, you know, this part of this much of a lesson, but they were successful and they did their best, those are things that we want to acknowledge and praise. So those are just a few tips. And I know I went a little bit over. That was kind of the presentation that I have for you today. So much to talk about. I'm happy to hear questions and thoughts afterwards.